beautiful people, welcome back to my YouTube channel. If you're someone for the first time, you're welcome. My name is Lana, and on this channel we create content on faith, on nursing, on health, as well as makeup. If these are the kind of content you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. So in today's video, I'm going to be talking about a condition that most women suffer from. In fact, about 80% of all women experience or suffer from this condition at one point in their life, because some of them don't experience symptoms, they are not aware of the condition, and if this condition is not treated on time, it might end up posing a health risk to such a woman. So with that, let's talk uterine fibroid. Now, what is uterine fibroid? Now, uterine fibroid are abnormal growths that develop in or on the uterus, which is a womb, and they are usually non-cancerous, meaning they are most likely not going to spread. They are made up of muscles and tissues, and they are the most common type of non-cancerous tumors that are present in women. Now, there are several types of fibroid, but the most common of them is the intramural fibroid, which is located in the muscle layer of the uterus, that is, of the womb. Now, what are the signs and symptoms of fibroid? It's important to note that it's not every time that someone with fibroid actually experiences any form of symptoms. There are women who live their whole life and do not even know that they have fibroid in them. That's because no symptom, no sign, so they're good to go. But some persons do experience, symptoms. Now, for women who experience symptoms, some of the symptoms could include metorrhagia, which is simply heavy, prolonged bleeding. Now, for women who are menstruating, such women will have prolonged bleeding that is lasting longer than normal. The number of days is supposed to have their menstruation, and it's usually heavy flow. You're losing more blood than expected or normal. So metorrhagia is one of them. Number two, we have dysmenorrhea, painful menstruation. So for such women, they experience severe pain during their period. And I've also talked about dysmenorrhea or menstrual cramp already in the previous video, so please do well to have it. Also, we have intermenstrual bleeding, that is bleeding between the period. Now, between period A and the next period, there's usually a space, a time of rest where the body is recuperating. Okay, now that time of rest, you are not expected to be bleeding, but for some women, they experience bleeding. We don't call that menstruation, call it bleeding, during their period of time. So see your period now, when you're supposed to breastfeed, you still have, slight spotting or bleeding, and then you have the time of your next period. There could also be bloating when your abdomen is looking big or protruding. That's what we mean by bloating. We also have dyspareunia, which is painful sexual intercourse, as well as constipation, which is passing of hard stool. There could be presence of low back pain. There could be frequent urination. You're urinating very frequently. There could be vaginal discharge, as well as incomplete voiding, which is that feeling that you have not emptied your bladder completely when you go to eat yourself. That is incomplete voiding. These are some of the symptoms that women with fibroid might experience. Now, someone might ask, what exactly causes fibroid? The truth is, the exact cause of fibroid is unknown, alright, but there are certain factors that could predispose an individual to having fibroid, what we call the risk factors. One is not having children. Not just not having children, but not having children at a certain age, okay, might predispose you to having fibroid. Okay, so there are certain age which medically you say, you're advised to start having children from 24 years, to 35. So if by that time you've not had children, you might end up having fibroid. Okay, it's one of those factors. Also, family history. If there's a history of fibroid in your family, your mom, your sister, an auntie has fibroid, you're at risk of having fibroid. Early menarche, which is the first time you see your period. If it started very early in life, you are predisposed to having fibroid. Also, late menopause, which is the termination of the period or menstrual phase of your life, you are predisposed to having fibroid, as well as obesity. So these factors can predispose an individual to having fibroid. Now, how do you diagnose fibroid? You cannot just see an individual and say, oh, because of the symptoms the person is experiencing, the person has fibroid. You know, you have to go to hospital, and then certain checks have to be carried out on you for you to know if you have fibroid or not. Now, one of them is ultrasound scan. You have magnetic resonance imaging, which is the MRI. You also have CT scan, which is the computed tomography scan. There is laparoscopy. Finally, we have hysterosalpingography. So, what are the complications of fibroid? For women who do not experience any form of symptom, usually women who their fibroid, the size of their fibroid is very small, they might not experience any form of symptom all through their life. Such women, they might not also have complications. Okay, but usually women who experience symptoms are women who their fibroid has a larger size, alright, and some of the complications that may set it include excessive bleeding. Now, the woman could bleed and bleed and bleed to the extent that she ends up suffering from anemia. Anemia is simply reduction in the oxygen carrying capacity of the blood. So the woman may end up coming down with anemia as a result of excessive bleeding. There could also be pain, severe pain. You know, such a woman starts experiencing usually abdominal pain, and there is also chance of infertility depending on where exactly that fibroid is located, and also depending on the size. It could also be swelling of the abdomen. Now, some persons, the size of their fibroid grow to the extent that it looks as if they are pregnant or they have been pregnant for a long time. Such women are experiencing fibroid. Now, how do we manage fibroid? Thank God there are several alternatives to manage the fibroid, but note that management or treatment of fibroid depends on how big, how small the fibroid is. That's the size. It depends on where exactly it is located in the womb or in uterus, and also it depends on the number. There can be 2, 3, 4, clusters of fibroids, small fibroids located in the uterus. So it depends on these factors. Putting this into consideration, then the management can be determined, the right line of treatment can be determined. Number one is medications. Medications like pain relief, you have the NSAIDs, acetaminophen, can help you for the complication, which I said increase pain. So as a result of the pain that you'll be feeling, you can take some NSAID, some pain relief that can help you out. Birth control can actually help with symptoms, especially if you suffer from severe. So another means of management is hormone therapy. Now, one thing with fibroid is that it increases in size, especially when there are certain hormones that are predominant in that individual. For example, women who are pregnant, there's increase in production of progesterone and estrogen, which is needed for the preservation of the pregnancy, right? But these same hormones play a great role in increasing the size of the fibroid. So in women who are pregnant, some women notice that they have fibroid when they are pregnant, because the fibroid is growing inside as a result of increase in hormone production. So for women who fall into this category, that is women that are not pregnant but these hormones are in excess in the body, hormone therapy can be carried out. Now, drugs can be given that will prevent the production or reduce the excessive production of this hormone, thereby helping to reduce the size or preventing the further growth of the fibroid. Iron supplement is very important, especially for women who are experiencing excessive bleeding or they are already anemic. Very important. Iron supplement will help you very much. Then we also have surgical intervention. Surgical intervention in the form of myomectomy, which is removal of the fibroid, can be done. Okay. Also, there is hysterectomy, which is the removal of the uterus as a whole. It's the only cure of fibroid. If you do myomectomy, removal of fibroid, it might come back again. But by the time you do hysterectomy, the womb is not there, the uterus is not there, so there's no way of the fibroid coming back. Okay, so but I would advise you do it when you're sure you no longer will have fibroid. So what are the means of preventing fibroid? Now, you can prevent fibroid if you avoid the risk factors of fibroid. So try and avoid the ones that are avoidable. Then you are most likely going to have a high chance of not having fibroid. Now, I want to answer some questions I usually get from women. Most women ask me, is it possible to get pregnant if you have fibroid? Yes, it's possible. I know I said that one of the complications of fibroid is infertility, but that doesn't mean you cannot get pregnant. Okay, it's very, very possible to get pregnant. It's very possible, in fact, to not just get pregnant, but deliver your baby and fibroid doesn't grow inside. Depending, okay, so it's very possible. Another question people ask is, are fibroid cancerous cells? I define fibroid as usually being non-cancerous, meaning they don't spread. So people are asking, okay, are there fibroids that spread? Yes, they're actually fibroids that spread, but it's very, 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 very rarely that it happens. Most times, fibroid do not spread. So with that, I hope I've been able to educate us on uterine fibroid. If you have any questions, recommendations, or if there's anything I left out in this video, please let me know in the comment section below. And I'll see you next time. Bye, lovelies, and God bless you.